I just want to start by saying good afternoon. It's lovely to be here and thanks for the invitation to present today. As Natasha said, my name's Jess Heerde and I'm an associate professor at the University of Melbourne and at the Centre for Adolescent Health, which is at the Royal Children's Hospital in Melbourne. And my research is on the health of children and adolescents who are experiencing homelessness. So before I go into this, I also want to acknowledge that I am joining today from the lands of the Wurundjeri people of the Kulin Nation here in Naarm, so Melbourne. And I want to pay my respects to their elders past, present, and emerging. So let's just start with a little overview. What we know is that adolescents are a highly neglected group in research. We know that 95% of all research that's done on young people 0 to 19 years old is actually of those between the ages of 0 and 5. So we know that research on adolescents and older children severely neglected. And then when we think about marginalised adolescents, that research area is even more neglected. And I think that that is probably a reflection of the fact that research with these groups is extremely challenging, as everyone in the audience probably already knows. I have spent over 12 years conducting research with marginalised children and adolescents, and predominantly those who are homeless and insecurely housed. And for me, I combine a lived experience perspective, which is my lived experience, with health and psychology training and a population health approach. And I do that across both quantitative and qualitative research areas, and more recently in the realm of data linkage, which is a whole new ethical conundrum. And I've encountered many challenges from ethics committees over this time, all aspects of conducting research. And drawing on this work, I recently led the book chapter that I've got cited there, which is really an overview looking at how we conduct research with marginalised adolescents from a range of groups. And this presentation, being quite short, just draws on 3 case studies related to work that we've done with young people who are homeless. So it's complex work with groups who are marginalised. And that marginalisation and vulnerability among those groups can arise from a variety of different contexts. Some of those contexts are common across groups of adolescents. So things like childhood trauma might be common across multiple groups. And some are unique for specific groups. So we might have young people who are in contact with the justice system, or others who are, for example, have experiences in out-of-home care. But I think for most adolescents who are marginalised, these contexts really intersect with one another. And that means that there are multiple challenges for conducting research within this group. It is resource intensive doing this work, and I think that's due to the need to really adapt and be flexible in the research methods that we use with these adolescents. It's also time intensive, so timelines can really blow out depending on how much you need to adapt for different groups. And in addition to that, there are also structural barriers to contend with. So sometimes those are imposed by the social systems these children and young people are a part of. So it might be gatekeepers in the justice system or in the child protection system. But then there are also research ethics and governance pathways, that we need to think about. And I think the biggest one there is really, for example, the fact that, the age of these young people and the complexity of their circumstances means that by their very nature, they are a vulnerable group. And so, greater than low risk committees must have oversight over those research projects, which, from a consumer perspective, absolutely warranted. From a research perspective, sometimes makes things a little bit more challenging, but I think those are the processes that, we all know that we need to go through. And then in addition to the national statement, I also look at these health research guidelines, which are published by the Society for Adolescent Medicine in the US. Obviously different context, so not guidelines that we take on face value here, but I guess more that inform the work that I do. And those guidelines really talk about, I guess, the benefits of research engaging adolescents, but also some of the ethical principles, the legal context, and the participation of adolescents in research. And those have been around for about 30 years. So first published around 1994 and updated out next year, I believe. So the first case study I kind of want to present here is around how we gain informed consent. And you can read the comment at the top of the slide there, which is a comment that we received from an ethics committee a number of years ago. And I think it highlights how informed consent with adolescents, particularly those who are homeless, is not as straightforward as we might like it to be. In our experience, gaining informed consent really begins with thinking about who's the legal guardian that can provide consent for this young person. Or on the flip side, can the adolescent provide informed consent themselves in the absence of a parent or guardian? And in our work, most of the adolescents we've worked with who have been homeless have been unaccompanied, meaning that they are on their own. They don't have a parent or guardian, and many are also not under the care or guardianship of the state. So as context, many of those young people have left home, the family home, due to violence. They don't have family contact, and seeking parental consent might actually be a process that puts them in danger. Also, the requirement to get parental consent would be a significant barrier to the participation of those young people in the research that we do. So how do we get around that? We draw on the concept of a mature minor to, I guess, allow adolescents to provide informed consent to participate themselves. And that process really lets us, I guess, work with adolescents in a one-on-one situation. And we can be confident that if they understand the research process and their participation in that process, then they can provide consent for themselves. So the second example here, and someone feel free to give me a heads up if we're running over time. So the second example I want to talk about here is creating a safe space and location to collect data. We want to create a two-way conversation with adolescents to understand their experiences of homelessness and also their life histories. Now, that process in itself can be quite time-consuming. We spend a lot of time attending the settings that these young people engage in, so homelessness services or other support services. It also includes building rapport with staff as well as young people. And sometimes staff might introduce the project to adolescents, just informally to build that trust and rapport with them. And those are all things that we do right into our ethics applications. So the quote I've got at the top here is a quote that we received, again, a number of years ago around where is an appropriate place to conduct interviews with these young people. And I think the point that I would make here is, we don't want to make a presumption that, interviewing an adolescent in a private or an adolescent who with experience of homelessness in a private or isolated room with someone who is not known to them is a safe option. For many adolescents, that's actually, I guess, an unsafe or could be a potentially threatening situation. So we often use cafes or kind of private areas in cafes or libraries as a way to increase the feeling of safety for those young people. And the final example I've got here is about remuneration, and this one never fails to come up with ethics committees. Um, I think what I would say here is it's important to treat adolescents, regardless of their background, with dignity and respect, and offering reimbursements really is an important part of expressing appreciation for their time and for their participation, because in many cases, these young people are talking about deeply personal and traumatic experiences. Um, so I have in the past had ethics committees, talk about the economic and social vulnerabilities of these young people in a way to safeguard against reimbursement being an incentive for them to participate. Oh, hang on one second. Um, and I guess what I would say to that is I have never had the experience of young people engaging in research just for money. In fact, I've had quite the opposite, that a lot of the time young people don't want to take a gift voucher that we give to them. And I think that that is often because these are young people who go through quite coercive behaviors and relationships in their homelessness experience. Um, and so, as part of that, what we do is give reimbursement to young people prior to the interview taking place. So, once we've got informed consent, we give them the gift voucher, and whether they participate or not after that is really up to them. And that really is, I guess, a way of ensuring a bit more safety, taking the pressure off adolescents, and reducing that likelihood of coercion. So I'll leave it there. I hope I haven't gone too far over time.
Thanks so much, Jess. We're 1 minute over, so we're dancing
well.
through presenters. Thank you so much.
Thank you.
We did have one quick comment. Sophie, did you want to respond to that question?
Yes, I can. Jess, we've talked about this a number of times. I'm Sophie, I work at the Children's Hospital. This was a question around what mature minor means. So mature minor is based on capacity to understand. That's how our HREC look at it, and that will be determined on a case by case depending on what the research is, because the research context will dictate someone's capacity to understand. And state legislation on the ability to consent without parental consent varies, and institutional risk varies as well. Risk appetite varies. Jess, did you have anything else to add to that?
I would just add that it really is a complex process. So it's, like I said, about making sure that young people are treated with, dignity and respect, but also from a research perspective, making sure that you put the time in to cover all the bases.